There we go. Well, it's good to see your face again. I'm watching the names pop up of the attendees, and there's names that I recognize and like people that I have interacted with. So I feel like, December was a little bit of a drought, and so I'm glad to be back here with my friends. On the just an announcement on the enmeshment workshop side, we have another in-person mega workshop scheduled. Dr. Adams and I will be co-facilitating in Michigan, June 6th through 9th. The one we did last year in August, I think we were full by May. So if you are thinking about an enmeshment workshop and you want to do it in person, I don't know if he's posted on the website yet, but you'd be safe contacting the office and saying I want in the June in-person workshop. That was a lot of fun last year and a really good experience. Our group was not quite twice as big as we normally do, but it was a bigger group, and I think I think that was in some ways better for the guys than our smaller groups too. The co-facilitation with Dr. Adams and I, you get the best of both of us. Our topic today, this might stir some pots a bit for everybody involved. In fact, I hope it will, because I think it's really hard to get something quality and long lasting in a relationship, which is what our webinars, my educational content focuses on. It's hard to get that without some struggle. Sometimes that struggle, a lot of times that struggle is external, and a lot of times it's an internal struggle we have with, well, wait a minute, isn't it supposed to work this way? And as always, what I present today, I want it to come with a practical alternative. So I'm going to start by making my case for why diagnosing your partner is not a good idea. And I'm going to end with how I think you can get what you were wanting to get out of diagnosing your partner properly and more. I want to outline a better way to get at what you're looking for. So the title of today is "What's Wrong with You?" And I call it that because that's exactly how that comes across. When partners come to each other and say, you are clearly a blank, or you clearly have blank. So in early stages of recovery, and I apologize, I'm looking down more than I do because my desk is set up just a little bit different today. I'm in a different room, so my notebook is a little lower. So I'm not looking down in shame or try not to engage. I have to go a little further to find my notes today. Especially in early stages of recovery, I see huge battles in couples over getting the diagnosis of each other right. And I totally understand where that comes from. If there's been a discovery or a betrayal, the world is upside down and you're trying to figure out what has happened. And don't get me wrong, diagnosis has a place in treatment. We'll talk about that in a minute. A lot of times the diagnosis is comforting because there is usually, if there's a diagnosis, there's usually a generally do this, and it makes things better. So while diagnosis is important in treatment, it's a bad idea for couples to diagnose each other, and ultimately, it's not helpful. There's a more helpful approach. So first, let's talk about what is diagnosis. Diagnosis is a careful, comprehensive assessment, and what's the word I want to use? Conclusion made by a treating qualified professional. So two keywords: treating and qualified. Even if you were a trained professional, you are not qualified to treat your family members or your spouse. That's what we call a dual relationship. And it ruins therapy and it ruins relationships because the role that a therapist or a treatment provider has to take with a person is different than an intimate partnership role. Even though there is a lot of intimacy and there is a lot of the same things, it's a fundamentally different relationship. And I don't care how good you think you are at walking the line, nobody can wear both of those hats and not have some heads explode, their own and others. So this qualified treating professional considers differential factors, biological, psychological, social, the role that brain injury might play, different modes of compulsivity, mood disorders. Like there's a lot that goes into the soup of coming out with an accurate diagnosis that not only takes the training and the qualifications, but it takes a level of personal detachment, I would say. Oh, shoot.
We can still hear you, Jon. We could still hear you. Hang in there, everybody. He'll be right back. Mm. Hang in there, everyone. He's coming back.
Oh, there we go.
Gotcha now.
I don't know who crashed or what happened there. Sorry about that.
Yeah.
So let me just back up a little bit. I think what I was talking about was qualified treatment in order to provide diagnosis and considering differential factors. Ethical diagnosis is evidence-based, meaning it doesn't come from a gut feeling. I think it might be this, or, sadly, I've heard from other professionals, I know an addict when I see it, that's definitely an addict. That's not diagnosis. Diagnosis is evidence-based. We're looking for frequency, intensity, latency, duration of behavior. When it comes to addiction, we're looking for how does this impair normal functioning, consequences in life, corroborative evidence. It is not made outside of the practitioner's scope of practice and competency. So in my practice, most therapists are at least lightly trained in some differential diagnosis in graduate school. I actually, if I suspect a mood disorder, I refer that out for evaluation because that is not my scope of competency. I know what mood disorders are. I know some of the things to look for. I know enough to say we might want to look here. I am not qualified to tell somebody you have this type of mood disorder. I'm not versed in that kind of diagnosis. So all of the reading you do about what your addicted partner might, all addicts show this, or all partners struggle with this, because there is not professional training, because that is not your job, you cannot provide a diagnosis to your partner. So one of the things that trying to diagnose each other does is it creates this who's one up in the relationship. If that wasn't existing already, just notice what happens when you go to your partner and say, I know what your problem is. And generally in relationships that aren't super secure functioning, once somebody does this, the other one's going to do this. And then we do this back and forth. So it's really destabilizing to the whatever amount of collaboration there might be in the relationship. It's not friendly. It's not collaborative. And I know at the beginning of recovery, most people do not feel friendly and collaborative towards their partner. But I think friendliness and collaboration are actually some low-hanging fruit type goals that we can start to focus on early in recovery to keep the relationship functional. Because if there's one thing worse than having a hard time getting stable in your early recovery, it's having the drama in your relationship or the conflict in your relationship being the distraction to you being able to get stable early in recovery. So I think it's really important for couples to try to minimize as much of the relational chaos as possible by making some of these tweaks. Again, not because it's not important or your feelings aren't important, but some wisdom around how we structure this can go a long way. Now, when I describe what diagnosis is, I used a lot of really technical, dry terms because that's what diagnosis is. It's technical, it's dry. It's not based in emotion. It's not based in relationship. when you insert this role into a relationship, there's an automatic disconnection and alienation. On a good day, oh, I'm glad I'm so fascinating for you. On a bad day, who died and made you, my doctor or whatever. So that injection of that dry, dispassionate, um, technical aspect, it's like I said, it's not friendly or helpful. I just want everybody to think, when is the last time you experienced telling your partner exactly what you think is wrong with them, what they have or don't have? Um, when is the last time that that has changed things in a meaningful way? I'm not saying it never ever happens. Sometimes that is the like miracle swing for the fences home run that makes all the difference. Um, I don't think that the bulk of the time that we see a big difference made, that it comes from that. So use with caution. There's a better way. There's a better way to get at what you might be wanting to get at with you have this. Secure functioning would encourage us to focus on what is not working, not why it's not working. Let me say that again. In secure functioning, we're less concerned, or we don't perseverate first on why isn't this working. We first look at defining what is not working. And we stay focused on what's not working in a secure functioning relationship until we both have a similar enough idea of what's not working that we can start to act and react and move intuitively in ways that actually bring relief. So your partner's long-term connection to their deficits is better attained through coming to it rather than spoon feeding. So when you tell your partner, this is what's wrong with you and this is what you have to do with it, if you're lucky in that way of thinking and you have a very compliant partner, they'll jump through all sorts of hoops and they won't internalize and you'll remain disappointed. If you point to the trail of breadcrumbs, I have concerns about your relationship to sex. I have concerns about your relationship to pornography. I have concerns about how painful and easy it is for you to fall into a big vat of pain around your triggers and your trauma. I'm worried about how quickly and often you're losing your temper. I'd like you to focus on that. I'd like you to see if you can figure some things out there. Or I'd like to see this, not that. What do you think? It's better to focus on the problem behavior, not the person as the problem. And I'm not trying to be new agey and, we can't have any shame. I'm saying from a practical standpoint, I have seen people of all sorts of stripes of like distasteful and difficult personalities be able to function very well in relationships and even, have them and their partners glad that they're in the relationship because they're focusing on what behaviors are problematic, not on completely changing each other. So some suggestions for helping the focus on problematic behavior, not let me get the diagnosis right for you and tell you what's wrong with you. Ask for and give some options for what you would like to see happen. I have concerns about your relationship with pornography. It makes me feel replaced. It makes me feel betrayed. I would like to see you stop using it. I would like to see you turn to me or our relationship with what you want sexually, not other people. Or I would like to see you and I talk about the kind of sexual relationship we want to have rather than you strongly hinting or manipulating or pushing, or me having no idea and you getting resentful. I would like to see you work on your anger. Would you be open to taking some time outs? Would you be open to talking to somebody? Would you be open to spending 3 to 6 months with a therapist, really hunkering down on that and seeing if you can make some progress there, seeing if you can make some changes that feel better for both of us? Stay focused on your feelings. not what your partner's responsibility is in creating those. And again, I'm trying to say that really carefully. Of course, what people do puts feelings in us. But to stay focused on feelings can help if there's any bone of empathy in our partner, if there's any hope that there's empathy, staying focused on our feelings um, can help the urgency, can help the my desire for this to change, that can help that message to get through faster. Then stop doing that. I don't like it. This really hurts me. Do you realize this isn't fair? This really hurts me. Do you realize I feel like you don't love me? You want a relationship with everybody else but me. That makes me so sad. That makes me want to crawl under the covers and never come out again. Um, give yourself some options. I would like to see you work on your anger. I'd like to see you work on your relationship with pornography. I would like to see you take a deeper look at your relationship with other people rather than saying boys will be boys or girls got their needs. Um, I borrow this from Dr. Adams' book when he's married to mom, his chapter written to the partners of enmeshed men. He walks through kind of this formula for encouraging your partner to work on this. So I'm borrowing this formula from that. Um, I would like you to get with a qualified therapist and work with them, and I'd like to see some improvement within 6 months. If not, here's what I'm going to consider. I'm going to need to pause this part of our relationship, or I'm going to be considering whether or not this is a good relationship for me to be in or not. I'm going to get some help myself. I'm going to practice boundaries and self-care. Because you and I don't have good mutual connecting and caring for each other going on. Thursday night's my night. I'm going to bug out selfishly and I'm going to take care of myself. And I'm going to continue to do that until I see an option for us to do more of that together. Give yourself some options. Remember that what people do to cope that hurts others is often deeply rooted in trauma, fear, and anxiety. So expect pushback when you come and say, I have concerns about your relationship to pornography or sex. Or I have concerns about how unfairly you treat me. That's not a justification. But think of the last time you've tried to take a favorite toy from a dog or a baby or a bottle or a blanket from a baby. Like you get pushback, you get a fight because that's a comfort object. In a perfect world, it shouldn't be. But don't get surprised when you get the pushback. That may actually mean that you've got pressure in the right place. They're feeling the potential loss, and that's okay. You'll have to work on your ability to tolerate the pushback. You might have a part of you that says it's wrong for me to hurt my partner in that way, or if they're mad at me, everything's wrong. You might need to work on the part of you that has a hard time tolerating that. Keep it framed by the relationship. Ultimately, your relationship to pornography is not working for us. When I feel betrayed, I have zero desire to be close to you, and I know you like to be close to me. This is a problem for us. It's not a place where I feel like I can be close, and it's not a place where you feel like you can reach me. Neither of us are getting what we want here. So keep it framed in us. And notice how I say there, this is not our problem. We have this little problem with pornography. We'll get through it. That's not what I'm saying. I'm saying if this goes unchecked, it's a problem for us. Seek support for yourself. Understand and stay out of unhelpful roles. So we talk a lot about rescuing. We talk a lot about, I'll use the codependency word. Those are not parts of us to be ashamed of any more than, I have a cousin where, we joke that neither of us has an inside voice. There's certain settings where I'm really glad I don't have an inside voice. Like I can project, it can carry, I can get attention. It's not a bad part of me. However, when I'm in a therapy room with somebody and I'm trying to be reassuring and gentle and not, activate things. I got to find my inside voice. It's not because the outside voice is bad. It's not appropriate for there. So there's some parts, there's some roles that are easy for us and even natural for us, but not helpful. And it is okay to seek help to be able to put some of those unhelpful roles on the shelf, to let something else come forward, not because you're bad or wrong, but because what you're doing may not be helping you, may not be helping your partner. So seek support and understanding on that. And then hold your therapists or doctors or whoever's diagnoses very lightly. So I see this all the time and it drives me up a wall. And if I had the treatment community here, I would say, remember everybody, it's not ethical to diagnose someone you've never met. Even if you feel like you're hearing something really clear from the person you're meeting with about their spouse, you cannot diagnose somebody you have not met. So remember that your therapist's perspective about your spouse on a good day is really their opinion about your projection of your partner. I say it this way to my individual clients: I can only help you with the spouse inside your head, because that's the only one who ever comes here. So there has been some recent research that's been released that has indicated that in many, many cases, individual therapy can hurt relationships, because individual therapists can run the risk of crossing a line into relationship therapy without really assessing or diagnosing a coupleship. So when your therapist has opinions about what is or isn't going on with your partner, I'm not saying discount it. I'm not saying believe it completely. I'm saying hold it lightly. Recognize, again, like I wanted to go into detail about what diagnosis is, so that you don't get swept up in the relief that comes with having a name for it. That can be really, really alluring, especially in early days of recovery when things are really chaotic. That can be very, very alluring. So again, hold it lightly. Focus mainly on yourself and what's happening with you and what you need to do to get safe and sane, and fill in the holes with what might be going on with your partner from reputable sources. Blogs, and I'd say even podcasts, there's a lot of good stuff out there. There's also a lot of stuff that's off point. So, just like they teach you in college, get your information from a variety of sources. Hold discrepancies. Remember that the field of mental health psychology on a good day is a soft science. So that means our understanding is always evolving. And that can help to stay up with some of that. On the same token, the diagnosis does not hold the answers, doesn't hold the solutions. It's a tool that professionals can use to organize treatment. But, like professional grade tools in the hands of a professional on an industrial sized job, they're great. Industrial size and industrial grade tools may not exactly be what I want to use to build my kid's treehouse. That's a little more personal. That's a little softer, requires more of a personal touch. So that's what's wrong with you. I hope the guidelines in the end came through pretty clear. That's the topic for today.
Yeah, I like that a lot. My thoughts on diagnoses are they don't define me. I wear them like a loose garment. Yeah, it's here, but it's not who I am 24/7. Yes, when my PTSD kicks in, I need to deal with it. But I'm not going to be, hi, my name is Scott. I have PTSD, at the cocktail party or the neighborhood picnic. It's not the first thing out of my mouth. It doesn't define me. And diagnoses don't define relationships, or they shouldn't. And I love, yeah, don't diagnose somebody you haven't met, because we all tend to do it.
Yep.
So all right, let's jump into the questions, because we've got several of them already. Okay, I am working really hard on helping myself. This is a betrayed spouse. I have 3 different types of therapy going on, and I'm utilizing tons of seeking integrity resources. I've been having a few days of feeling almost normal, But it seems inevitably I just explode with rage when I get triggered or remember the reality of our situation. It's so much easier said than done to control my anger by using coping skills, etc. I got a full disclosure about a month ago for context, and I have 4 months postpartum, which has complicated everything. Any other advice to help with the ongoing rage that seems to lurk right under the surface?
Yeah, yeah. So first, I'll recommend a fantastic book about anger. It's short, it's accessible, it's smartly written. It's called The Anger Management Jumpstart, and it provides 4 really practical skill sets that I've noticed more than anything has helped my clients change their relationship with rage. And I won't get into the specifics there because it's a lot more than just an answer here. So that's one thing is um, I'd say accept that one head on. I'm having a problem with rage. That's okay and so understandable in this. I mean, understandable as any part of the human condition. So you know, give yourself some grace and let yourself really take that on. The other thing that I would say here, I'll speak to what I read into this as a almost an expectation. If I'm working on the right things, this part of me will be kept in check. Here's the best that I've seen therapy be able to do for rage and anger. It's like when this will tell you a lot about what my life is like right now. It's like that point when a little kid realizes that when they throw up, they can predict it and they don't just have to do it all over what they're sitting on. That like can run to the toilet or the garbage can or like ask for a bowl or say like I don't feel good. Um, I think good therapy can help us to feel that it's coming on, and then just like vomiting, a lot of times it's not helpful to keep it in and prevent it from happening. It is helpful to channel it. It is helpful to make sure that it doesn't get all over everything that we love and require a lot of cleanup. So um, in that, I'm glad that you're having some days that you feel normal. The thing that catches my attention about that expectation is I explode with rage. To me, that makes it feel like a volcano. Sometimes when we desperately want to get away from a feeling, what we do is what initially helps us feel better is more like it helps me repress or ignore rather than incorporate or integrate would be the word. So your anger is a part of you, and certainly work on some skills that help it not slap everybody in the face. But also, I hope your focus isn't set on I don't experience it because don't get me wrong, anger feels bad, or it can. I think it can also feel really great, but it feels bad, especially when there's consequences. But it's also a very natural part of being a human being. So I would look for channeling rather than containment. And again, that anger management jumpstart, life changing for your relationship and for how you understand what anger is and how it works. And it's not big at all. It's an easy read and there's a lot to mine from there.
Yeah, that's one of my favorite analogies ever. I think, oh, I'm gonna throw up. Um, and it's really apt with anger and rage. For those of you who don't know, John has several kids, a couple of which are very young. So, um, let me ask you a question though. This one, I have 3 different types of therapy going on, and I'm utilizing tons of seeking integrity resources, which is great. But is there such a thing as maybe let's prioritize? Um,
Oh, yeah, yeah, totally. It wasn't until I injured my back in a really stupid way that I got this insight into mental health therapy when I got to do physical therapy for the first time. Um, I had ignored or tried to tough my way through this injury for long enough that when I first met with my physical therapist, I said, "All right, I've been dealing with this for a while. Like, what do you think about everyday sessions? I can come in this early." And my physical therapist said, "It's an intriguing idea, but it doesn't work that way. Like you need some time, not just to build the strength and the structure around this, but you actually need real rest time." So, some of what we looked at was how I was resting and how I needed to rest in some different ways. The way my back injury felt, it felt like I really needed to stretch this way. And actually, he said, you're this close to a popped vertebrae, you need to stretch the other way. And so like it was this really counterintuitive form of rest. And sometimes having too much going on in our therapy or our group stuff can really burn us out. And anger is an outcome of burnout a lot of the time. So that would be something to look at too. What's the pacing? Is there some time that you can sit and track your feelings, not just get ideas and knowledge, which is important, but there's a balance. Like the bicep and the tricep, you have to build both at the same time, or you can only get so strong. So the work and the rest therapeutically is really important too.
Yeah, I mean, and this goes for addicts and betrayed partners. I mean, addicts will come to me sometimes, and I'm doing, 4 different work groups, and I'm seeing my therapist twice a week, and then we have group therapy once a week, and I'm going to 3 meetings a day, and I'm just like, when do you sleep? I mean,
Yeah,
uh,
some,
it's too
some,
much. Let's pick what is priority today, and let's
yeah,
narrow this down. And um,
some
so,
some people for a time that's just right for them.
time. Yeah,
I rarely see that is the sustained need. And yeah, priority one thing at a time. That's especially when you're the betrayed spouse. I think that's one of the things that's so frustrating is this big stinky dead fish showed up on my lap and I can't just shove it all off at the same time. Like I really have to work on it piece by piece, and it's not fair and it doesn't feel good. But um time doesn't heal all wounds, but it's a really, really important factor because in time is like rest is how we integrate. Rest is where parts of us come together. Focusing on one thing at a time tends to be more efficient, more energy efficient actually, than trying to multitask and track everything all at the same time. So yeah, priorities are good.
okay. No question here. Just wanted to say how happy I am to see you both. Hi. Missed this webinar and you for quite a while. Yeah, good to see you. This is someone I know. So hi. As a betrayed partner, something I hear a lot that I don't understand is the shame spiral and shame driving the addiction. Um, that as a betrayed partner, I need to choose my words carefully so I don't make my addict feel shame, as if being seriously heartbroken and angry isn't enough. I also need to be careful not to hurt my sex addict's feelings, because he will feel shame. Shame makes me less likely to do that something. Um, this goes on for a while, but yeah, I mean, shame, betrayed partners, you know, can you explain shame spirals and the betrayed
Yeah.
partner's role or non-role in a shame spiral for the addict?
So a shame spiral is, shame's a really interesting emotion. It actually has a really great social utility. Shame is a socially learned emotion where when we get disconnect from others in response to our behavior, that's a clue in that I've done something that can hurt my herd, hurt my tribe, which we're herd animals. So we need to be aware of how our behavior affects the herd. The problem with how shame gets used is it gets weaponized. And so it's not just the like, oh, hey, that didn't feel good, and that, burst of shame that actually can serve as a reset button. It's like, I'm gonna rub your nose in it. And we get that from parents, we get that from culture, like it comes from all over the place. So the shame spiral is any emotion that's not integrated in us that we can't tolerate. Once I feel one little bit of it, I start to feel the whole history of it. And shame, we're particularly prone to that spiraling down. There's some shame spirals that I have gotten into where I'm going all the way back to like, I remember when I was 6 and I said that thing to that kid. Like it's real shame, like it's real regret. And it's not useful in the moment. It's really turns me inside myself, brings up a lot of pain. Certainly that's where the connection to shame and addiction comes from, is this is a really painful emotion that if we have relationship trauma or we've been isolated or anything like that, we are going to struggle to connect. So addiction is a really accessible solution to make us not feel that way. So that's the shame spiral in a nutshell. The idea of I have to be careful not to make my addict feel shame. Here's what I would say about that. Nobody ever develops an immunity to mustard gas. So the idea of you can't bring this to me, I think for addicts or even for partners, it's a misunderstanding that, again, sorry about the mustard gas comment. I thought that made more sense until I said it. There's a misunderstanding that shame is so toxic that I can't experience an ounce because as soon as I do, it will always have the same effect on me. No, there's an ability to develop resiliency to shame. And a piece of that is Brene Brown may disagree, and she's probably more, well, she is more of an authority of this on me, but I like previous to Brene Brown, you'd hear people like P. Melody talk about healthy shame and toxic shame. Brene Brown talks about guilt and shame, which I think is kind of the same idea. One of the ways to develop resiliency to shame is to focus on what we have done that brings that feeling up in us. So one of the ways that I manage that in the therapy room, sometimes I have to give really pointed, hard feedback to people, and I will say to them, what I'm about to say to you, I mean that as an observation, not a criticism. So the mechanism that feedback, the feedback that I give brings up shame, but the package that I'm putting it in helps it to be the kind of shame that person can look at. I'm reiterating, I don't hate you or think you're awful because you do this or because I see this. I'm saying there's a problem, or there's this thing that I've noticed that seems to be a problem for you or seems to be difficult for you. So I think you really have to watch in the situation this person's talking about. You have to watch for this idea that we have to have an environment that's sterile from shame or recovery can't happen. I think that's actually an underdeveloped part of us that says, I can't, you make me feel shame. I cannot feel that. You are making this worse. Like, yes, there's a piece of that, but then there's also your addicted partner's responsibility to be developing resiliency. And sometimes that resiliency can take the form of, saying to you as you are heartbroken and angry and saying things, saying, you know what? I need to take a break from this conversation. I am getting overwhelmed in my shame, and I'm going to go call my sponsor. I'm going to practice some self-care, and we will come back to this. I will pick this up, but I need to take a step back. Sometimes our shame resiliency is being able to internalize. I think you're communicating more to me about your anger and your hurt than you are the truth about who I am as a person. Sometimes the shame resiliency takes the form of again, boundaries. I've seen both addicts and spouses use this to great effect with each other. Hey, listen, what you just said to me, that would never fly if I said that with you, or that tone you just used with me, that would never fly with you if I said that or did that to you in that way. Can you find a different way to tell me what you are? Like, there's all sorts of like there's where the mustard gas came in. Shame is not mustard gas. You can develop a tolerance to shame. It does not immediately kill you if exposed to it, and that's part of what addicts and spouses have to work on. Is shame, like anger, is a natural human emotion, and it's often the avoidance of that causes more of the problem than the dealing with. So I hope that answer is helpful there.
Yeah, I think so. I mean, whether you're using the older terminology of shame and toxic shame, or the newer terms of guilt and shame, and I don't care which one you use, the healthy shame slash guilt is, I made a mistake. I did something bad. I think I feel bad about it. I'd like to behave differently in the future. I'd like to make amends. It exists in a system of accountability and respect, and
Good.
it
Yeah.
motivates us to change. Very healthy emotion to feel. Not a fun emotion, but a very healthy emotion because it motivates me to look at my behavior, become accountable, and make changes. This other kind of shame, the toxic shame, is the difference is I made a mistake versus I am a mistake. This toxic shame is there's something inherently wrong with me and there's nothing I can do about it. I'm screwed. And I guess if you're going to try and be around me, you're screwed too. I mean, it's like quicksand. It just keeps us stuck in our behaviors. It is up to me as a recovering addict, and I'll just speak from the addict point of view here. It's up to me to say, if my partner comes to me and tells me about the hurt, pain, and all this, to look at that and say, you're not saying I'm bad, you're saying I hurt you. I did
Yeah.
something. Okay, I can deal with that. I can be accountable. I can ask how I can change, what I need to do differently, or I can go into a shame spiral.
Yeah.
And it's my choice. And I don't like shame spirals, so I'll usually try to change. Go ahead, John. Sorry.
I was just gonna say, as the partner in that situation, maybe some of the only and best help you can give is to remind, I want you to hear how I'm hurting. I want you to pay attention to that part, not what you think I think about you. Because very, very often, like I don't see betrayed partners saying, I need my 7 pounds of flesh before I can finally ditch you. They're saying, I love you and I want to be with you. But what you have going on makes that so difficult for me to do in a safe, self-respecting way. Another way of saying that is you are hurting me. So that could be a suggestion there as you're dealing with this. I want you to hear how I'm hurting, not don't try to figure out what or don't listen to what you think I think about you. I want you to hear how I'm hurting. That's why I'm talking to you about this, because this hurts.
Yeah. Yeah. I mean, I mean, going back to the topic of the day, diagnosing your partner, to say you're a narcissist and an addict is different than saying you're behaving in narcissistic addict ways and that bothers me. It causes me. There's a very big difference. So yeah, betrayed partners can phrase it differently, but still, it's really up to the addict, I think, to just
Yep.
recognize, yeah, I
Yep.
did do something wrong. I need to be accountable.
Well, and to
Shame
that,
is this perfectionism system. I'm either perfect
yeah.
or I'm crap. And it doesn't work. That's not life.
Well, that's what I was just going to say when it comes to this issue of shame. In secure functioning intimate relationships, we cannot be so concerned with not making messes that we don't take risks. Relationships cannot be clean and messless, like you said, Scott. That's a perfectionist shame-based system. So, the thing here is not we got to avoid shame at all costs. Like I said, it's not mustard gas. It's can we put some resiliency in our system? I love how you said, Scott, healthy shame exists in a system of responsibility and accountability.
Yeah.
And that's so true. That's so true. So you can inject, you can co-create a system that can actually utilize healthy shame to help us move where we want to go. Um, don't try to eliminate it. You can't.
Yeah. Okay, let's go to the next one here. We got a couple left here. I think it's a great idea for me to reframe how I approach my SA partner regarding his betrayals, but I'm exhausted. I'm exhausted explaining why basic respect is important. I'm exhausted by circular conversations. I'm exhausted by his language and actions are abusive. I'm financially stuck, but I find interaction with him intolerable while he continues to figuratively spit in my face. I'd appreciate your thoughts on this. Very interesting,
Yeah.
John.
Yeah. So I guess the biggest thing that I'm looking at here when I have couples in protracted arguments and it's circular, which is what I'm hearing here, coming to the same
Yeah.
place, not getting out of this. What I will say to them is, so the point you just made to your partner, did that get through? Did that help them see something or understand something they didn't before? And generally, the points that we have said 5,000 times to our partner, um, the 5,000th and first time that we say it is not going to get through. So I'll say, take that one off the table. It's not effective. Use a different tactic. So I hear in here what you're describing, that is such energy intensive stuff, explaining circular conversations. This is how your language is abusive. Uh, I would encourage you to think about some different ways that you can uh, get at what you're trying to get at with the circular conversations and the explaining this or that. Because what you're doing is not working for you or your partner. That's why it's happening again and again, and that's not your fault. But I had a mentor in my life at one point who would say to me, sometimes a change is better than a rest. And I don't think that's true all the time, but sometimes definitely, definitely. And this sounds like, a rest may not be possible with the financial situation, but a change could be. And that's where I would look at, change up your repertoire, change up how you're going to respond, allow yourself some freedom to explore some different ways to interact with this. Because, like I said, you're spinning your wheels and you're burning out.
Yeah, I think it's Sue Johnson who talks about the dysfunctional tango that we do with our partners. We know all the steps and we just keep doing the same dance. And we need to learn a new dance. And couples therapy can usually help with that. Are there forms of couple therapy that you would recommend, John?
Yeah, PACT is awesome for this kind of stuff because a well-trained PACT therapist will get beneath the words that are said and can usually do a pretty good job at identifying the blocks to understanding and doing better. Um, uh, Depends on if you're looking for just, marriage therapy with someone who is betrayal and addiction informed. Sometimes they've got the right approach. Sometimes the approach can actually heighten this
Yeah.
dynamic. So with that, whoever you decide to go see for marriage therapy, make sure both of you are on board and make sure that both of you are feeling out, do we think this person could help us? Um,
Yeah.
so yeah, that's what I would say there.
Can you help me, please? I've been alone for 3 years and the unfaithful partner has returned in my life. It has been 3 months and he is really trying to be better and show support and empathy, but I feel a lot of tension in my body. It's getting worse and worse. He is overloading me with gifts and wanting to help me, but I miss me and I'm recovering from all past traumas in my life and I feel overwhelmed. People in general are too much for me. I need so much time for me and my recovery. It's just a roller coaster. What can I do? He also got sick during these years, and his care is too much for me. A lot going on there.
Yeah, a lot going on there. So a couple things that are standing out. How do I want to say this? Um, so the tension in your body, that's a part of you that may not have words. That's a part of you that may still have some things that are unresolved from here. And, in the vein of the last question and answer, what's going on right now doesn't seem to be helping that tension in your body. There's some parts of this that feel a little like we call it an anxiously attached partner here. There's lots of gifts, there's lots of help. Um, a lot of times, I think the first uh, reasonable action we feel tension in our body is to say, everybody back up. And I would say in this situation, that would be a good boundary to practice. Everybody back up. And coming back to what's happening in me and what do I need um, could be a good way to go here. Um, I think when there is betrayal, that there are, sometimes it's the fulfillment of the, most ardent fantasy we have that our partner shows up again and says, I can do better now and I want to do better. Your partner feeling like they're ready to do that and you being ready to do that could be two different things. And so again, there I would say practice some good self-advocacy there. Stay in touch with those feelings, and just because it's on offer now does not mean you have to accept it. A lot of us can have anxiety. Well, if I don't take this now, it won't be there later. I would say if this kind of attention and intention in the relationship doesn't have the legs to get through some, hey, I appreciate where you're coming from, but I need you to take a step back. It's not real solid in the first place. So try some of those boundaries. That'll tell you a lot about what this is, and it'll give you a shot at attending to what you need, because only you can.
Yeah. And we had a question, PACT therapy. It's actually PACT, PACT therapy, correct? Okay. So just if anybody wants to look it up. This last one. So can you connect shame to why sex porn use somehow alleviates shame temporarily? Even okay. Um, Sex and porn use does not alleviate shame. It distracts us from the pain of the shame we are feeling. Sorry, I'm just going to answer this one, Sean. Um, it, Addiction is about, it's a distraction from the problem. It's not a solution to the problem. It feels like a solution to the problem, but it isn't. When I'm done using porn, all the shame is still there. Plus, I've got a fresh layer of shame on top of it because, oh my God, I did it again. And I swore I would, and this time I looked at this and, oh God, I mean, I can't, all of that. No addiction cures any problem. All the addictions do is distract us from the pain of the problems. So it doesn't alleviate shame. It just papers it over for a little while. John, if you want to add to that, go ahead.
This is perfect answer. And the only thing that I would add to that is human beings under immense stress don't care about the long term. It's, can I feel better now? And turns out, sex is really awesome and powerful about at making us feel very differently very quick.
Yeah, it's a
Um,
huge dopamine, huge adrenaline rush, on par with cocaine. I mean,
yeah,
it's a drug.
yeah, and that's where addiction is born, is not necessarily in the inherent nature of whatever it is you're seeking. It's, we call it set and setting. So where I'm starting and where this behavior or substance takes me, if where I'm starting is super low and this takes me super high or super away, like that, the wider the gap, the more addictive pull there is, the more addictive potential there is. Because feelings like shame, rejection, uh, abuse, anger, all that kind of stuff, that's such a hard part of the human condition. Um, we're wired to seek escape from it. It's in our biology to get what feels better now, not long term. Our biology is all about now. Our frontal lobe is the evolutionary piece that humans, and we're discovering a lot of other animals actually can do this kind of long-term thinking. But that's that's not our biology, that's our thinking, that's our planning. That can, in addiction recovery, we start to make the connection. Oh, it really doesn't make things better. I'm sick of dealing with the compounding shame. But that's a completely different way of thinking than when we're in addiction, is we're actually forcing ourselves to look longer down the road rather than what gets me out of Dodge right now.
Yeah, definitely. We're out of time, everybody. Thank you for the great questions, John. Thank you for the great topic. So great to see you again and to be back on track. We'll be back here in 2 weeks, everybody. We hope to see you then. Anything you want to say to take us out, John?
No, thank you. It was a pleasure to be back, and I'll look forward to seeing everybody in a couple weeks. Bye.